Can a polypectomy procedure miss dangerous colon polyps? Imagine sitting in the doctor's office, hearing that a colonoscopy is one of the best ways to prevent colon cancer by catching and removing polyps early. But even with this powerful tool, can some dangerous polyps still be missed? The answer is yes. While colonoscopy and polypectomy are highly effective, they are not perfect. Several factors can influence whether a polyp is overlooked or not fully removed. During a colonoscopy, the doctor uses a flexible tube with a camera to look inside the colon and identify polyps. Advances like high-definition imaging and special techniques, such as narrow-band imaging or artificial intelligence, help improve detection. Still, small or flat polyps can sometimes be missed, especially if they blend in with the surrounding tissue. Studies show that even experienced endoscopists can have varying success rates in spotting these tricky lesions. The size and shape of a polyp also matter. Larger polyps are easier to see but can be more difficult to remove completely. Flat or sessile polyps, which sit flush against the colon wall, are harder to detect and may be missed or only partially removed. Polyps located in hard-to-see areas or behind folds can also escape notice. Another important factor is the skill and technique of the doctor performing the procedure. The quality of the colonoscopy is often measured by the adenoma detection rate, which reflects how many polyps the doctor finds and removes. Higher detection rates are linked to fewer cases of colorectal cancer later on. Variability among doctors means some may be better at finding and removing all polyps than others. The method used to remove small polyps also plays a role. Cold forceps removal for tiny polyps, for example, has a higher chance of leaving behind residual tissue. If some tissue remains, it could potentially grow and become a concern later. This highlights the importance of choosing the right removal technique based on the polyp size and appearance. Visual estimation of polyp size during the procedure can sometimes be inaccurate. This can affect decisions about how to remove the polyp and whether additional measures are needed to ensure complete removal. In summary, while polypectomy during colonoscopy is a key step in preventing colon cancer, it is not foolproof. Some dangerous polyps can be missed or not fully removed due to limitations in detection technology, the characteristics of the polyps, the skill of the endoscopist, and technical factors. Ongoing improvements in imaging, adherence to quality standards, and careful follow-up are essential to reduce these risks. If you have had a colonoscopy, it's important to follow your doctor's recommendations for surveillance and discuss any concerns you may have about missed or residual polyps. Remember, maintaining regular screening and open communication with your healthcare provider are the best ways to protect your colon health.